Oh,
Oh, I'm
really?
sorry.
Okay.
You
Oh,
were
no
saying
problem.
such gems, I was going to record you. So I was going to
Oh,
ask you, so with your son, now, how does
mhm,
that present with him? And has it been something you've known, or was
mhm.
it something that, okay,
I diagnosed my own son.
okay, all right,
And that was weird because I guess in a way, if you're religious or if you feel lucky, then I felt that I was in the right place at the right time and I was the right mom for him. And I knew, but I was working for a psychiatrist at the time. And she was like, no, no, you're just seeing things. He's fine. Um, I was like, no, he's not turning his head and looking at me. He's not babbling. He's not cooing. He's not doing all those little cutesy things you see other babies doing. He's
uh-huh,
not interested. He wasn't interested in his mobile. So the I will be a little chopped and screwed is what I call it about this presentation because I really want to go through this as a mom
right,
and as a clinician because I'm straddling the fence like it was kind of like that lupus thing. I'm a patient and I'm a health educator. Well, I'm a clinician and I'm a mom. So when I'm talking about these things, they don't, when I was doing it, I was like, oh, it's coming off like I don't know what I'm talking about. And I know exactly what I'm talking about.
right.
Um, so
No,
I guess,
and they're difficult topics for you, and it's probably very difficult to separate all of the things that you know from what you wonder if other people know. You know what I mean?
right, right. Because I didn't want to make an assumption that people knew something that I knew, right? So, and then it is hard for me being a parent and being a clinician. It's hard for me to separate the two when I'm like playing with my son or because sometimes you have to cut it off and then I'm assessing like, okay, is he hopping on 2 feet or what is he doing? So
Uh-huh.
sometimes that's kind of hard.
That's
Um,
exhausting, really.
it's actually fascinating to me. It is.
Oh.
It's fascinating to me that I'm able to, my left and right brain will work in tandem for that.
Well, I
And
think you're correct. God blessed you with the perfect child for you, and you for him.
mhm, yeah. Like I don't know. I have a dark sense of humor, so go with me here. My first child was what they call neurotypical, and she was like she's very smart girl, has a high IQ, um, went to early college, and she was just such a easy kid. And then we were like, okay, well, we'll just have another kid. And then the second child is always the most challenging. I can
Oh,
definitely say
the
that.
last, yes.
Yeah.
I used to tell folks when my children were very young, that God gives you what you can handle. So God obviously had a low opinion of us as parents because he gave us these terrific kids. And then our family about 13 years ago went through some trauma,
Mhm.
and those kids changed, you know.
Mhm. Yeah. Trauma
And
will
life
change.
became very difficult.
Yeah.
So I guess I know in a way, I think I know in a way
Yeah.
what it's
You
like
do.
to have something affect your child that's out of your control,
Mhm.
and to feel just alone. No matter how much support you have, you feel alone. I did.
You do. You do. Trauma changes the family. Trauma changes the brain. That was actually my field of study for my doctorate was trauma responses on children, and then what that looks like in the school, and then what that looks like as adults, and then how those adults um, adapt with those trauma responses. That's actually what I looked at, and it's very interesting. And
Well,
one thing I was wondering about the majority of our audience, am I talking to clinicians already? Because if I'm talking to clinicians, they already know this stuff.
you are and they don't, probably would be my answer. I'm surprised again that I deliver 100 level courses, and I tend to get 87 to 92% approval on everything I do. and it's basic information. But even though it is, I think those who know appreciate a refresher, and there will be something you will say that will touch them in a way that they didn't know. You know what I mean?
Hmm.
They're here for the right reason, and you're here for the right reason. But it is all social workers and maybe 4 or 5 nurses.
So of course they're gonna know this stuff. I'm assuming. I hope they do. Look, I'm like, I hope they do. Goodness me.
Remember, you're an educator today, and then probably every day, and
Yeah.
so they know what they're getting. They've been to mine before. Most of these people are return people.
Return people. I was wondering, I think I took a course with you the other week, and it was like you were like gone, like you were on the screen. I was like, huh. Maybe you just
I
didn't
was
feel like it
using
that day.
it probably, I have constantly have, and I am again, having trouble with my computer
Yeah,
because it
computers
won't,
are the
now
worst.
it won't charge. So I was using my wife's, I think, which is a touch screen, which totally rocked my world. And I made all kinds of mistakes on the settings. But the one prior was on, and I was just getting to the good part, I thought, was on sickle cell, and it ran out. My battery died. It said it was charged, but it wasn't. So
You know,
it's just embarrassing and unprofessional, but there's a ghost in my machine.
you know what? Technology is so smart. Sometimes I think it's dumb.
I've all along said my smartphone is much, much smarter than me.
Absolutely. Like, I don't know how much I probably could have been a rocket scientist had I had a phone when I went to school. Like the
Oh,
card catalog and the Dewey Decimal System.
oh, right.
If I would have had Google in high school, I promise you, I probably would have been like a rocket scientist.
I'm sure
Yeah.
you could be.
Yeah. Like I have a touchscreen computer too. And my husband works in IT. And so I do all kinds of stuff in my computer all the time. And everybody in my family just takes our computer and gives it, just hand it over to him like this, because we don't know. Like, what?
Right on your knee, my liege,
Right.
my Lord.
My Lord, please fix me.
Uh-huh. Uh-huh.
It's, yeah. I was asking him, I was like, yesterday, I can't hear my audio and I have a presentation. And he was like, did you turn the volume up? And I was like, really? Are you asking me, did I turn the volume up?
That would have been the correct question for me.
Yeah. But he's like,
I've
you'd be
almost learned that.
surprised.
Now, did you want to change? Because I don't see the swoosh. I just see your pink shoulders, which looks really pretty. So there's
Okay.
3
Well, if you don't see
left.
the swoosh, then that's fine. I
No, I
don't
don't.
know. Ever since the NIL thing, it's like kind of, I'm like, I'm not endorsing anybody. I'm not endorsing anything, although I'm not an athlete either. Try not to.
I have it long held that I don't want other people's names or emblems or logos on my shirt.
Mm-hmm.
I bought this shirt to wear, not to advertise for you.
Right. That's another reason why I was like, can you see that? Ew. I think that's the older I get like that.
Yeah.
Mm-hmm.
Well, it's 2 minutes till. I'm going to finish typing here, and I've enjoyed talking with you. Oh, by the way,
Oh,
before we go, let me know if you know any good trauma therapists,
okay.
like particularly with DBT or CBT.
Mm-hmm. What type of trauma? Because some people specialize in different types of trauma.
I'll tell you offline because we're recording, but it relates to personally.
Okay. Yeah, I was waiting to answer that question because I wasn't sure if we were recording. So yeah.
Yeah, thank you. I shouldn't have even brought it up
No,
knowing it
it's
was
okay. No,
recorded,
no,
but
no, no, no. No problem. I can definitely
the world
answer
will
your
see
question.
this. The world that watches this will see this. So I have no way to edit.
Oh, kids are good with that
Then
too.
now I tell you. Now I tell you.
Oh, well, I guess we'll just go with it.
We will go with it.
Yep.
That's my way of floating through the world.
Mhm. And also stop me if there are questions. I don't, they're like, I tried not to make like 100 slides. So yeah, I'll go slower. I know you
Yeah,
said
and
I
you
have
can
30
ask,
minutes.
like, just because, like, my fault, you know, if you watch these, when we ask for people to discuss, and if you ask people questions straight out, they'll answer.
Uh-huh.
I'll say, hey, tell me this, blah, 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 and
Mhm.
wait. It'll be a minute. You'll be like crickets at first, but it'll come right.
Yeah, I try not to put like 50 slides on here. We don't need to do that. And just explain. Mhm.
Let's see. I forgot to do something. Here we go. All right, it's 12 o'clock.
Okay.
So I will open the gates.
Open the floodgate.
I will. 55 so far. And here we go. Welcome, welcome, welcome in, everyone. Welcome to Care Concierge with Care Patrol, where education is the heart of everything we do. And in keeping with that, we offer these Zoom courses to you as social workers and nurses 6 times monthly. We're accredited by the boards of nursing and of social work in the state of Alabama to create and credential and provide these CEU contact hours. And we're very happy to be able to do so. Good afternoon, Ms. Underwood. Today, we are joined by Dr. Nicole Bown, who is a doctor of social work and has a number of other letters after her name and almost enough vowels to spell another name. So she's highly educated, not only as a clinician, but as an individual on many of the topics around which she teaches. And Mrs. Reddick says, hello, Felicia. Hello, all. Hello, says Lisa Johnson. And hello, everyone. Thank you for being here. I'm going to post our evaluation link into the chat room. Those of you who've been with us know, and those of you who haven't been with us need to know that our evaluation is necessary for you to receive a certificate and credit for today. Nurses, we will post your hours for you onto the nursing board, and social workers, you will be asked to post your own. You'll receive these within 24 hours. And if Dr. Bown agrees, she will share her presentation. I'll provide that as well. The evaluation is an online evaluation, and it's usually password protected, although today I did not. I forgot, my bad. But the link is https://www.surveymonkey.com/lowercase r/ all uppercase letters and some numbers 5-9 P as in Paul, L, Z as in zoo, H, L. One more time quickly, https://www.surveymonkey.com/lowercase r/all uppercase letters 5-9 P as in Paul, L, Z as in zoo, H, L. That is our password for today, and everyone is posting it, and I thank you so much. I've finally gotten it done. Oh, this is a nice comment. Mrs. Strickler says, hi, I'm excited for today's webinar. My son was recently diagnosed with high functioning ASD. I love learning things to help him thrive. So with that, I will turn it over to an expert, Dr. Nicole Bown, who will share her experience and expertise with us all. Dr. Bown.
Okay. Thank you. We're going to talk about our awesome autistic children today. Get it going. So that we get a good understanding of autism, we're going to start with child development. So everyone develops at slightly different pace. Almost everyone has the same general development milestones and learns the same set of skills at about the same rate of time. We learn a lot as kids, if you think about this. Everything from our language, and whether we're going to learn one or two languages, communication, socialization, cognitive skills like problem solving. We make physical milestones, crawling, walking, fine motor, and gross motor skill milestones like holding a pencil, jumping, and riding a bicycle. Those of us in child development and mental health, we know this as ages and stages, right? All of these things progress, the brain. This is progression of brain development. And if any of these domains don't develop as scheduled, and depending on the severity, it may be described as a type of neurodevelopmental disorder. Neural referring to the brain, especially when certain skills related to socialization and communication don't proceed normally. And it can result in being isolated and feeling isolated, which is where the name autism originated, since auto means self. Autism refers to a condition where somebody might be removed from social interaction and communication, leaving them feeling alone and isolated. Before 2013, the fourth edition of the Diagnostics and Statistical Manual for Mental Health, or the DSM-4, it described autism as one of the severely pervasive developmental disorders, and this is what was included. Pervasive developmental disorders, or PDD, was used to describe children who were not progressing developmentally, cognitively, mentally, socially, verbally, but they were growing and developing physically and on target or close to target for that. Autism was described as children who had deficits in the same ways as described above, but had delays that were atypical. And then there was Asperger's syndrome that was used for children that appeared to have characteristics of autism, like difficulties with social interactions and nonverbal communication, but didn't have significant delays in language and cognitive development. This is why Asperger's was referred to as high functioning autism previously. And then you had childhood disintegrative disorder, and that was, that was characterized by or described for a child that developed normally for their age, but then they seem to lose some of their acquired social skills. And that happened about in between 2 and 10. And then there was something that they call pervasive developmental disorders, NOS. And we know that to mean that it's just a catch-all that describes children and patients who had met some, but not all features of autism, Asperger's, or the CDD. So parents started complaining, which rightfully so, that maybe their child was not diagnosed correctly. And researchers and clinicians found that separate diagnosis of these disorders were not consistent across the board. So there were some children that were getting an autism diagnosis or a PDD diagnosis, and it was not correct, because some of these situations and these diagnoses are very similar with signs and symptoms. So what happened is all the previous terms were placed on a spectrum and then called autism spectrum disorder. And ASD for short it encompasses all the previous pervasive developmental disorders, but uses a scale or spectrum that differentiates based on the severity of the individual. So now we're going to a more individualized situation to describe what clinicians, parents, and caregivers are observing. Okay, so the criteria for autism was changed, and it became based on the severity of two major areas, which was social communication and interactive deficits and restrictive or repetitive behaviors. So clinicians, we are looking for deficits. The first is the social reciprocity, which refers to how children respond or reciprocate in social interactions. So like how the behavior of one person influences the other and vice versa. An example of impairment in this area might be preferring to be alone and not taking a role in social games. Peekaboo, hide and seek, things like that. You may, cover your eyes, say peekaboo. That child, usually a neurotypical child, they're gonna laugh, they're gonna look. You may be looking at a child that you suspect to be on the spectrum. You're gonna play peekaboo at that child. They're not really paying attention. They're not interested in the reciprocal play with you. The second area of potential deficit is joint attention, which is the state of wanting to share an interest with someone. So as in a child finding a toy and wanting to share that toy with the parent or peer. So I pick up Spider-Man, I'm interested in Spider-Man, and I show Spider-Man to mom. Hey mom, look, it's Spider-Man. Or hey friend, look, I got a new toy. Usually what you're gonna look at with a child that may be on the spectrum, they're not gonna be interested in sharing their interest or their amusement with a toy. That child is gonna take that toy, they're just gonna play with it. You're not gonna know whether that child is excited about playing with the toy. You're not gonna know if they're indifferent about playing with the toy. But what you may notice over time, you may know that that child prefers that toy or likes that toy because that's the toy they're gonna pick up repeatedly. But they're not going to say, hey mom, hey friend, Spider-Man, Minnie Mouse, whatever toy they're looking at. Next, there's nonverbal communication, which refers to difficulty either using nonverbal communication or interpreting nonverbal cues. So maybe that child won't put their arms up when they want to be picked up, but then they're crying and you're confused about what that child wants. They're not hungry, they're not wet, but you're trying to figure out what they need. Now, most of us would then pick the child up, some of us, depending on your kid or the child that you're dealing with. But, maybe that child, usually kids will put their arms up when they want, mom, dad, aunt to hold them. A child on the spectrum may not do that. They want you to pick them up, but you're not going to be, their nonverbal cues are not giving you the sense that they want you to pick them up. Or maybe that child is not able to tell the difference between when that parent is upset or frowning. The parent may be frowning, crossing their arms, crying. That child is not connecting with what that nonverbal means. Somebody's crying, they're upset, or they're hurt. That child's not going to be able to connect with that. The last subcategory of communication deficits is social relationships, where children have trouble developing and maintaining relationships. So maybe the child has a hard time making friends or keeping those friends, but their behavior tends to drive them away. So, maybe an older child that wants to play, but they may bite or they may hit. Um, they consider that play, but to neurotypical parents and to children, they may shy away from playing with that child because they may be more prone to being a little more rough with kids than others, or they may not have a interest in playing, and so the other kids feel like or perceive that is that child doesn't want to play. The other major area is called restrictive and repetitive behaviors, and this category is pretty broad and can include a whole bunch of behaviors that some we know more than others, like lining up toys in a ritualistic sort of way, or flapping their hands, imitating words or phrases. They might be fixed on certain routines, like they want to, take the same route to school every day. They want to perform their tasks, their morning routines in the same way every morning. They might be restrictive of their interests, or have a specific in-depth knowledge of things like football, cars. They may want to eat only a certain group of food, or shy away from other groups of food or textures, tones, things like that. There is a hyper and a hypo activity to sensory input and output. And usually they're interested in those sensory aspects of the environment that most intrigue them. So textures, sensations, these kids are bouncing, they're spinning, they're jumping. Groaning may be soothing to them. They may enjoy different tactile things like sticky, smooth, cold. You'll find that those kids kind of lean toward that. As we continue with diagnostic criteria, we see that the symptoms must be present in early childhood. So we're not talking about a 9-year-old. What we're looking at is, we're not saying that 9-year-olds cannot be diagnosed, but usually you're going to see these situations and these symptoms early on. The symptoms must be clinically significant, and the issues cannot be better explained by a learning disability or a medical condition. Because we know as social workers and as clinicians, we always are told to rule out medical conditions first. All right, and so then we're looking at the other accompanying things that may go with this. Are there any other comorbidities that are going on here? Are there any other mental health issues that are going on here? Does this child have asthma, eczema? And so the catatonia that's there at the bottom, it's usually associated with schizophrenia. And so one caveat or trivia that you probably didn't know was earlier, before the DSM-4, autism was kind of lumped in with schizophrenia. And, some of the movements that the children find soothing, like we just talked about, jumping, rocking, or some involuntary movements, are kind of what is described as catatonia. So, of course, we're moving toward, a spectrum of things. And then there are also levels that were put on autism. I think now there are coming up with 2 new ones. So you may see in other places that there are 5 levels instead of 3, depending on where you work or where the child may be diagnosed. Meaningful diagnosis of autism spectrum disorder relies heavily on listening to what others observe at home and at school and in other environments. And then we use that to determine how much support that child and that family is going to need. A severity of 1 would indicate the child needs more support for social communication. They might speak in full sentences and engage in communication, but normal back and forth conversation with others don't seem to work, or repetitive and restrictive behaviors are there. They may have difficulty switching between activities because they're focused on the task they have at hand. On the other side of the spectrum, on the level 3, that may mean that a child needs substantial support. And on the social communication side, they might display very few words, rarely initiate interactions with others. They have repetitive behaviors that may be extremely, and they may be extremely resistant to change. And their behaviors seriously interfere with their daily life. It's thought that using this scale, as opposed to the differentials that we talked about earlier, will help provide more accurate and medically useful ways to diagnose children and to provide individualized treatment. And that's kind of where the medical model is going toward, individualized treatment instead of cookie cutter, everybody gets the same thing.
I'm sorry to interrupt. Is it, we've gone from 6 or 7 or 8 things in the DSM-4 to 3 now, which is all spectrum disorder, in the DSM-5. Am I following?
Yes, they put all those. Yeah, they put Asperger's, PDD, they put them all on the spectrum because, you know, you have kids that are higher functioning and they talk and they're able to engage, but they do have some pervasive issues. But then you have children on the other end that do not talk, that have issues with maybe hitting, biting, kicking, and they're not communicating with others.
What
So
would be, I'm sorry,
okay.
I feel very dumb today, but what would be, if you were to see a child that you thought had high functioning autism, what would be present that you would think so?
Okay, so you may notice that this child is they're very friendly and they will talk, but you'll notice that they don't talk. When they talk, they don't make eye contact. They don't make eye contact with you. They may be a child that is very fixated on, say, Alabama football. They know everything about Alabama football. That child may be what we call socially awkward. So, you know, they may not understand, or they may say things that you probably think in your head or maybe kitchen table talk, but that child will say it out loud. One of a good example, if you ever watched The Big Bang Theory, love that show, and I'm not, you know, endorsing, but pretty good example. There's a character on that show called Sheldon Cooper, and if you ever watched that show, you would probably think Sheldon Cooper was on the spectrum, and he was very high functioning. He's a very high IQ, was able to connect and make friends, but he was very socially awkward, and some of his mannerisms were hurtful but comical. So that may be a good way to explain that. Good. Okay. So here I've provided a milestone check for a reference of what children should typically be doing at different ages and stages of development. But I also wanted to stop for any other questions too before I went any further. But you can see, you know, you may have a child that has everything under social communication and interactive skills, and maybe 1 or 2 under restrictive or repetitive, and maybe 1 under other. It's, like I said, very individualized, and this is not a complete list. This is just a small suggestion of what you may see, hear, or observe in the child. Okay, causes for autism. This used to be a really big one. There is no single cause for autism, given the complexity of the disorder and the fact that symptoms and severity they vary, and may change, both genetic and environmental think situations and issues play a role. Genetics, there are several different genes that appear to be involved in autism spectrum. For some children, autism can be associated with genetic disorders like Rett syndrome or Fragile X. But for others, there may be a genetic mutation that may increase the risk of autism and may change the development of the brain. And some of these things are spontaneous. So there's still research being made about what genes, like the human genome has been typed out. And so they're looking at what different genes may cause autism. Like I said, we're going toward a more individualized medical model as opposed to just a one size fit all. So basically, yeah, we're talking about brain development here. There are some environmental factors that researchers are looking at and they're exploring, whether viral infections play a role, medications, or even some complications during pregnancy. There was a really big time when people were feeling like vaccines were causing their children to have autism. And I think that the jury is still kind of out on that one, but most of the research is showing that there is no significance between vaccines and autism spectrum disorder. In fact, the original study that ignited the debate years ago has been retracted due to poor design and questionable research methods. And so it is being, the American Academy of Pediatrics are asking parents to avoid not getting their kids vaccines because the benefits outweigh the risk. Because there's a risk for catching or spreading diseases like whooping cough, pertussis, that's what whooping cough is, measles and mumps. There is also some new controversy that's come out about Tylenol, Motrin, aspirin, and other over-the-counter medications and whether those things have caused autism spectrum. They're all over the television. You probably have seen a couple of commercials about it. So let's go on into some more diagnosis. This is what you're looking at is kind of a flow chart of what our physicians are doing, our pediatricians are doing in the clinics. And we want you to take your children and encourage your clients to take their children to their well checkups. The American Academy of Pediatrics recommends that children receive screenings developmental delays at 9 months, 18 months, 24 months, and 30. And if there is a specific autism screening that is done at 18 and 24 months. So it tries to catch at the before age 2. But if you see anything, if you have a parent that feels like there's something going on, most definitely bring those concerns to the primary care physician or the pediatrician. But babies develop at their own pace, and they don't follow exact timelines. So, these are just kind of, what we expect to see at 2 months, at 9 months, at 6 months. But especially if you get to 2 years and you see a significant drop off or not enough of a significant development in a child, please be concerned about whether or not, there may be something else going on, and make sure that those kids get to their primary care so they can be seen. Because signs of autism spectrum disorder often appear early in development. You may see things like a child that is not smiling or seeming to be happy by 6 months, or they don't mimic facial expressions. They're not playing peekaboo. They're not cooing. They're not gesturing, like they want their cup, they want water, they want juice. If they're not saying single words by 16 months, be concerned, or wanting to play or make believe or pretend by 18 months. is the recommendation from American Academy of Pediatrics, or that if they lose language, if they lose development, they seem to regress, be concerned and put up, that's a red flag. Okay, and so then there are so many different testing options that lead up to diagnosis for autism. The ASQ is the ages and stages questionnaire. It's about 3 pages long that moms and dads get. I remember receiving them myself for my children. Then there are other tests that progress when you're saying, okay, I see certain things that are happening with this child, or if you're a parent, I see certain things that are happening with my child. Then there are different tests that are standardized tests sometimes that are given to kids. Now, when you have school-age children and you're talking about diagnosis, what the state of Alabama is looking for is the ADOS, and they're looking for the CARS. And those are specifically looking for deficits in cognition and development, especially for, well, I live in Tuscaloosa County, but the state of Alabama is very heavy on the CARS and the ADOS. And those are, like I said, standardized tests that are given where they're looking at the kids' IQ and basically what they know or don't. Okay, so there are a lot of overlapping conditions and comorbidities that occur with.
I'm sorry. Can I interrupt again?
Yes.
When you say the state of Alabama uses, what do you mean in reference to what? Schools or?
Yeah, I'm sorry. In reference to schools, I'll back it up. Yes, in reference
like setting
to
up a 504 or something.
Setting up a 504 plan, setting up an IEP, getting it's weird. There is an educational diagnosis of autism, and then there's a medical diagnosis of autism. And that is because schools use standardized testing to do that. And then you get your IEP, and then you get your 504. In the medical world, they're using standardized testing. Like I told you, that ASQ you get when your kid is 9 months, 18 months, and 24 months. You can get a medical diagnosis for autism and take it to the school and they not recognize it because the ADOS was not done or the CARS was not done. During COVID, it was hard to do the ADOS and the CARS because a lot of those things were done with mask on. And what you're looking for is how the child reacts to your reactions, because we're talking about reciprocity and reciprocation. So if I smile, does the child smile? If I frown, does the child notice that I'm frowning or I'm sad? Well, when we had the mask on for COVID, ADOS and CARS were hard to do. And so there were a lot of places that were not doing ADOS for CARS, or they were modifying their ADOS and CARS. So yes, the ADOS and CARS, as far as the state of Alabama's educational system is concerned, those are the 2 main tests that they're looking for. As far as getting your medical diagnosis, usually they're going to use your ADOS and your CARS. Did I answer the question, or are you still?
Yes, I'm sorry. I also forgot how to mute and unmute.
Oh, no problem. No problem. Yes, as far as the state of Alabama is concerned, but there are several different tests, and I tried to put as many up here as I could. And then there's kind of an explanation about what those things actually do. The ADOS is the gold standard across the board, across the United States, as to children being diagnosed and assessed for autism.
And ADOS is Autism Diagnostic Observation
Schedule.
And then on this screen, on my left, the ABCs, those are more medical testing. And the right is for academics, I guess.
Yes, most of these are more academic. Like the ages and stages is more medical.
Okay.
Yeah, ages and stages is what you get at the pediatrician.
Okay. All right.
But yes, this was trying to explain what those different tests are, because parents get in, they're like, oh, we're gonna, assess your child. They say, oh, we performed the ADOS and the CARS and the CSBS, and you're like, what the heck is that? They don't explain that when you're in those rooms. So I wanted to make sure that I put those terms up there so that you can either research them or here where you can look and see what some of those are. There are some overlapping conditions and comorbidities with autism because kids tend to flock toward the same type of foods, pizza, bread, crackers. You may have constipation. There may be hyperactivity. There may be ADHD that is concerned. There are several different overlapping situations and comorbidities that happen here, seizures, disorders. So I wanted to put those up there and just say that autism is not one of those things that are just one size fit all, and it's just autism. You may be dealing with a child that has autism and ADHD, that has autism and has depression, and anxiety. So there are other things that go on with the child, but the main focus or the primary focus may be the autism.
May I ask another really basic, maybe stupid question?
Oh, absolutely.
How do ADHD and autism differ?
Ooh, they overlap, as a matter of fact,
Right.
because
So I've kind of
sometimes,
confused the two, I guess.
I'm sorry, I didn't hear you.
I said I kind of confused the two in my mind when I think about them.
When you're thinking about ADHD, you're thinking about a child that what you're looking at is attention and focus. Attention, focus, and activity. And a child with ADHD, they're going to be bouncing off the walls. If you can think about Tigger from Winnie the Pooh, that kid is everywhere. They are playing with Legos 1 minute. A butterfly may come by and they go, ooh, a butterfly. And forget about the Legos and they go over here and they play with, they go jump rope. And then before you know it, their attention has jumped several different times that you look around the room and you're like, hey kid, I need you to clean up. Y'all need you to clean up your things. A child that is dealing with autism and ADHD, they don't understand why are we cleaning this up? I don't get that. We're not going to clean it up. We're just going to continue to go. And as a parent or as a clinician, then it's you helping them understand the social construct of cleaning up, in addition to them having the issue of being hyperactive and their focus tends to change very quickly.
We had a question in the chat room. Ms. Dean, I believe, asked it, but now it's disappeared. I don't know why. So if she'd like to post it again, or if anyone else has a question for Dr. Brown, please unmute yourselves. You're welcome to do that. We love to hear your voice, or enter the chat room. Kimberly Strickler says, my son has ADHD and ASD. His symptoms overlap at times. Medicating for ADHD substantially helps him to focus on task, gives us opportunity to explain the how and why.
Yes. So thank you for saying that, Ms. Kimberly. There is no medication that you can give a child for autism. But the co-occurring issues that they may have, like ADHD, there is medication for that. And she is correct, because you're able to slow down his mind with the inattention, because it may be here. Then once you're able to slow his mind down, then you're able to explain the things to him that he may not catch with the autism piece. Yes, autism does have a lot of overlapping comorbidities. And the treatments for those are not medication. They are to manage these social constructs and educate them. There's behavioral therapy, and it all seeks to minimize or maximize quality of life and functional independence. So that's where your music therapies come in. That's where it's called a PECS board. It's a picture exchange communication system. So this is for children that are nonverbal and say they're hungry. They want cookies, or they want milk. Well, the PECS board gives that child an opportunity to point to or to select the items that they are in need of but unable to verbally communicate. I personally use sign language with my son, and it worked well. And we had to use the PECS board at some point too. So not only am I a clinician, but I am a parent of a child that is on the autism spectrum. Um, so the PECS board worked well for us. Sign language also worked well for us when he was nonverbal. So then you get into, yes.
I was going to say, Ms. Snyder has said that to my question that ADHD and autism actually share some of the same symptoms. ADHD doesn't typically limit someone's interest or affect
Right.
social skills. Autistics are typically more routine, but ADHD will not be able to stick to routines easily. I have kids with both, not an expert. And when you announced that you are also a parent, Ms. Snyder said, bless you.
I'm gonna laugh because I'm like, thank you. I sometimes need that. Yes, inattentive behaviors don't impede social emotional function, but social emotional function sometimes does impede learning or impede social engagement with the world. You will be looking at some treatments and interventions. You have speech, you have OT, occupational therapy, physical therapy. They're using equine therapy. There are some people who have social emotional dogs at this point. And then in the schools, you're looking at IEPs and 504 plans, and you're also looking at 504 plans when you're talking about college age, high school age kids too. And so here are some resources for here in our state now and national, and this is not all of it. There are hundreds of resources, but here in our state and maybe even locally, we have the University of Alabama Autism Clinic, and we have the Citizen Sparks Clinic, where my son goes, and that's at UAB. But there are a lot of different resources for you to get your child connected with resources, or for you to get your child evaluated for autism spectrum. But it starts at your pediatrician. So all things medically with your child will run through the pediatrician. And then, you know, how it branches out into specialties. So let's talk about some parent burnout and some other issues, which, you know, the mental health of parents, because being a caregiver is a lot. Parents are going to feel overwhelmed. Some parents are going to be ashamed. They're going to be confused about what's going on. They don't know, you know, how the world is going to perceive their child. So they're very overprotected. Some parents will isolate their children or isolate themselves. And even though I was talking about autism being sort of an isolation situation, what I mean is parents tend to protect their children and keep their children from, you know, mean adults and children who don't understand. So, you know, they may keep them at home or in their own circles or groups or things of that nature. There may be marital concerns. So you may have one parent that's in denial. You may have one parent that is, you know, wanting to know what's going on, but then you have one parent that's saying, you know, the child is fine. There are several different situations that can happen here. I want to slow down because I didn't know if you had a question.
Well, we do have a question. It's Amanda Bird, and she's asking if you have any resources to share for adults with ASD. I work in inpatient psychiatry, and a lot of patients end up here because the person loses services once they turn 18, 19.
You are so correct. You are so correct. And you know what? It sometimes depends on their insurance, and that is a sad thing for me to say as a clinician, and it's a scary thing for me to say as a parent. It sometimes depends on their insurance. If they have a Blue Cross Blue Shield tends to pay. and assist patients throughout the lifespan. If that patient is on, say, Medicaid or Medicare, it may be restrictive on what resources are available. Those same resources that I talked about for diagnosis can also be used for adults in treatment. There may be far and few in between as far as diagnosing. You may actually have to go to a developmental pediatrician for an adult instead of using your primary care. You may have to go through a neurologist to get your ASD diagnosis or their ASD diagnosis. Resources for adults that continue after 18 here in the state of Alabama, they would be the same as you see here for children. The insurance code just switches, if you will.
She says most have MCD. And Ms. Hutton said they can check with the Department of Rehabilitation Services in their area. And Ms. Lewis says, not sure of all of their resources and age groups, but Arts and Autism in Tuscaloosa is a great group.
Mm-hmm. It is. It's also expensive. Let's just be very honest there. Arts and Autism is a great program, but they're expensive. They do have a summer program that's really good. They have a program throughout the year. I think the barrier for some parents is either transportation to get their child out to downtown Tuscaloosa, or another issue is how much services actually cost per week. You are correct that you can use CRS, Children Rehabilitation Services, which is a part of the state. You can also use ADRS, which is Adult Rehab Services, that will continue for 18 and older. CRS will be used for 18 and younger.
Ms. Johnson is asking if it would be of any benefit for an individual in a long-term care facility to be evaluated for autism. His current diagnosis is schizophrenia, but he is clearly autistic.
I would not see a reason why not, because you may want to. That would probably help with some of the services that may open up for your patient. I think that anything is worth giving a try and being evaluated. You would start, for an adult, you would start with primary care, express the concerns, and then funnel your way down. Their developmental pediatricians will see adults. They will. As long as you're, I'm sorry, as long as they take your insurance, they will see you if you're 25, 5, or 35. Okay, so how do we help parents and caregivers? Let's lend a hand. Offer some respite that doesn't have 30 minutes, 5 minutes. Sometimes parents are overwhelmed. Be patient with parents. Sometimes, people say mean things, wanting to know what's wrong with their kid, why they're so loud. Just some people feel the need to just say some very rude things. If you have a question about their child, just ask. Parents are more likely to try to educate you than they are to bite your head off about it. If you have a loved one, send over a meal, offer to help them clean, or to help transport, because what happens is children, and adults, they end up needing a lot of out-of-home services. And that means that their caregiver is taking them to all these different appointments, and maybe they're not cooking as much. Maybe they need help there, or maybe the child has, like my child, for instance, has speech 3 days a week for 45 minutes. That takes a lot. So, I could have a hand with someone, and I do, taking my kid to speech so that I could cook a meal. That helps me out.
Mrs. Bird, or Ms., excuse me, Bird had said in answer to the question about being tested, that it could complicate things. The Alabama Department of Mental Health is one side of the fence or the other. It's a current issue we are seeing a lot in the hospital, but I think they are working on it.
Yes, they're working on it, and we feel like they're working slow, but they're working. To change the CPC code.
Ms. Sanchez has an address for folks. It's an email, info@AmericanAutismCenter.com, which is at 8909 Rand Avenue, Suite C, Daphne, Alabama, 36526. Phone number is 251-210-1632. So there's another resource. And I gather from the previous page or two that, I mean, you feel like there's really kind of a wealth of resources, or do you?
Yes, there are a wealth of resources. Sometimes there's a resource desert depending on where you live. For instance, if you're in the Black Belt, you may have a resource desert there. And just like you, person in the comments mentioned Daphne, Alabama. Well, if you live in Mobile, and you're close enough. But say if you live in Pineapple, Alabama, you're too far, right? And the closest major city here in Alabama to Pineapple, Alabama would be Tuscaloosa or Montgomery, but they still have to travel. I titled this one "Dear Providers" because I think sometimes providers forget that they're asking of parents a lot. So, you get to an appointment like, "Dear provider, start your appointment on time because I may have more than one." "Dear provider, no, we can't commit to therapy 3 days a week for 3 hours at a time. That's a big chunk of time. If you're going to say ABA therapy Monday, Wednesday, Friday for 3 hours, and then you have speech Tuesday, Thursday for 30 minutes, and then you have physical therapy 3 days a week, that becomes a lot. And it takes up a lot of time for caregivers. Because we have clinicians here, dear providers, use terminology your patients can understand, or please explain it to them. Like I was explaining about the CARs and the ADOS, usually when they give those tests, sometimes because we are used to using those acronyms, we do not explain to our parents and patients what those things mean and what they do. Please explain how this new treatment or medication will affect my child. Sometimes all these different appointments are overstimulating for those parents who are, persons of color. Sometimes autism resources are not culturally competent, but their equity and inclusion is starting to happen across the board everywhere. So those things are changing as well. I wanted to point out one. Dear providers, we are the experts on our children. And I only say that because sometimes providers sometimes feel that they know, we know the criteria for autism, but you don't know that child like the parent does. So listen to parents. That's one of the things for assessing and making the diagnosis, is that the parent is involved when using the questionnaires and giving their input. Myths about autism, that those kids are not smart. That's not true. That they're dangerous or violent. They're not going to be able to take care of themselves, or that maybe they'll grow out of it. We're think about this as, like I said, this is a developmental issue. You may be able to put enough services or get your child enough services so that by the time they turn 18, they're either easily able to assimilate into the adult world. But that doesn't mean the autism has gone away. That just means that you supported that child as a clinician and as a person to help that child grow and become an awesome adult, and that they're able to assimilate into the neurotypical world. The kids with autism, they get married. Adults with autism, they get married. They graduate and get diplomas. Some of these patients, these children, they're highly intelligent, and in many different areas. So a quote, I just put in a quote from an adult with autism. I'm a human. It just so happens that I have an autism diagnosis. Just like you may have a diagnosis of depression or high cholesterol. an adult told me what they want people to know is that they're human, like they're not specimens or, things to be gawked at. They want you to know that autism makes them unique, not different, and that they can do everything that you can do. It's just that they go about it in a different way. And are there any questions?
I expect some
good,
questions
huh?
will come. Did I
Okay.
interrupt you?
Mhm. If anything, yesterday they had here in Tuscaloosa, there was an autism walk. Saturday in Birmingham, they had their autism walk. There will be, April is Autism Awareness Month. So you will see a lot of things happening in your community, if not already, related to autism and making people aware of autism. When we think about it, we're thinking, let's think toward, brain development, and that person's brain has developed and is wired in a different way. It doesn't make them, it makes them a little different and unique, but that's the beauty of all of us as people. None of us are the same.
Wonderfully said. Ms. Dean is asking, are you seeing an increase in the ASD diagnosis?
Absolutely. There has been an uptick in ASD diagnosing in the field. Yes, I do see it. More kids are being evaluated. More kids are being treated for autism spectrum. The answer is yes. Mm-hmm.
I believe that the password is required on the survey, but I didn't set a password. Y'all just put anything and see if that works. And if not, I will go in and change it so there is no password required as soon as we end our session today.
There's not a
Honestly,
password to get into the survey, but on the number 1 question, it asks for a password.
oh, thank you so much.
There.
Yeah, just put anything, NA, not applicable. My fault, y'all. Darla Dean says, thank you, Dr. Brown. This has been most informative. And Donna Stevens says, we have our pinwheels up at work. Awareness is more prevalent now.
It is. It is. They use like pieces of a puzzle, and they're all in different colors. And I think that's actually awesome. Every cause has a color, like lupus is purple, green, mental health, but there are so many different
Ms. Hutton
causes and
says
colors.
thank you. Ms. Doohan says thank you. Anyone else have questions? We have about 3 minutes. If you have a question about your child or your experience or your patient, Dr. Brown, I think you can tell, is a wealth of experience and information. Ms. Morgan says, I really enjoyed this presentation. Dr. Brown shared a lot of great information.
Thank you. I surely do appreciate that. I appreciate you listening. Thank you. And if there's anything I can do to help, give me a call or an email, and I will definitely do what I can.
Ms. Hutton has a question. She says, Dr. Brown, what do you think would be good accommodations for a student with autism in college?
Like
a 504
okay.
plan?
Yeah, the 504 is what's used at in colleges. I would definitely ask for, say for instance, child be able to take their exams with a proctor in a quiet classroom. Sometimes they may be a little more, you may see anxiety about test taking in a classroom with others. So if that is the case, then you can ask for that child to have a different proctor, and they'll be able to take it in a different room with their proctor. You can also advocate for an emotional support animal if animals are something that helps that child. You can also advocate for having a one-on-one person with that student if it's needed. There's so many things that we can ask for at this point for accommodations for students. It's just awesome.
Thanks so much, Dr. Brown. A good review for an old social worker. Darla Dean says, I am curious. At one time, it was presumed that maternal-paternal age contributed to ASD. Now attorneys are blaming Tylenol. How does the environment come into play?
I think that's kind of what they're calling the environment, the Tylenol. Thank you, because you've seen that commercial too. It's like everywhere. They're talking about maybe, just go with me here. Maybe there are types of pollen in the air that change, you know, when it gets into your body, that changes the chemistry in the body that may affect the development in the brain, or, you know, there may be certain foods that could cause different developments within the brain. So that's where the environment comes in, you know, air quality, things like that.
I saw, interestingly, I read an article over the weekend, and it said that scientists have discovered that some people get frequent UTIs because the initial UTIs, the bacteria changes the genetic structure of the cells and makes them more predisposed to getting more infections. And I wondered, as you were talking about environmental resources, if not so much vaccines, but perhaps viruses or bacteria that children come in contact with at an early age, maybe that might be an environmental component that I don't know, I'm just spitballing, but.
That's what they're looking at. That's what research is looking at right now. They're looking at all possible aspects of what could cause the brain to develop differently, whether that's in utero or, you know, postnatal.
And
they're looking at all that stuff.
Ms. Connor had said to the earlier question, some colleges may have specific programs to help students with autism navigate through school. And then Ms. Hutton, excuse me, said some of the accommodations that we use are extra time, minimal distraction, note-taking, peer one-on-one. And now we've run over. Thank you, Dr. Brown. If you're still with us, she'll be back with us in May to discuss PTSD. Really looking forward to that. And then on Friday of this week, LaTanya Washington will continue her unit on self-care, and we'll follow up her 30-day challenge, which some of you may have started back on March the 20th. Thank you so much for being here today. Thank you again, Dr. Brown. Really, really great. Really great. Loved it. And I look forward to seeing you next month.